Hello, I'm Dr. Ponu Shangarapillai. In this video, I'm going to talk about carpal tunnel syndrome. So what does that word mean? So carpal in medical term, it means wrist. Tunnel means a passage. So there is a nerve called the median nerve that passes through the wrist. So carpal tunnel syndrome occurs when the pressure on the median nerve in the wrist within a narrow passageway called the carpal tunnel leads to symptoms such as numbness, tingling, pain, weakness in the hands and the fingers. So it's basically compression of the median nerve at the wrist. So symptoms often begin gradually, especially at night, and can be aggravated by repetitive hand movements. The exact cause is sometimes unknown, but there are some risk factors. What are the risk factors? Repetitive motions, that is work activities involving prolonged or repetitive bending and movement of the wrist, like typing, using tools, using musical instruments. Then inflammation of the wrist. So inflammation can be because of various reasons such as osteoarthritis, acromegaly, then certain conditions such as diabetes, hypothyroidism. So when somebody has symptoms in both hands, then we should rule out hypothyroid disorders, diabetes, etc. So how can we diagnose this condition? So from the history and the clinical examination itself, we can come to a reasonable conclusion that this could be carpal tunnel syndrome. So there is a test called Tinel sign whereby when we tap on the nerve, it produces some kind of tingling or paresthesia. This is a positive sign for carpal tunnel syndrome. So, but how do we confirm that this is carpal tunnel syndrome? There's a test called nerve conduction study. So by doing the nerve conduction study, we can find out or we can confirm that this is carpal tunnel syndrome. So what is the treatment? So there are different grades of carpal tunnel syndrome. There can be mild or mild tightness or moderate tightness or severe tightness. So when there is mild to moderate symptoms or mild to moderate tightness, then medicines might help, splinting, physiotherapy, all these things will help. But if there is severe tightness, so if it is severe carpal tunnel syndrome, then these conservative measures may not work. The medicines or physiotherapy may not work, and those patients will have to go for surgery or a release procedure whereby they loosen up the tunnel or loosen up the fascia through which the nerve is going. So what is a long-term complication of carpal tunnel syndrome? What if you leave it untreated? It can lead to thumb weakness and muscle wastage in this area. Thank you.